Welcome back to OpenLine. Thank you for being with us here tonight. We're talking to Dr. Jennifer McLaughlin with the Elite Audiology in Mount Juliet, and we're talking about hearing loss and everything that goes along with it. So if you have a question, go ahead and give us a call. 615-737-PLUS is the number to call. Lines are open, so feel free to call right now. We'll get to your question tonight. When we left before the break, we were talking about tubes for kids and when you should get them, when you should not get them. Let's also talk about swimmer's ear, because swimming season is coming up and a lot of kids are going to be in the water all the time. What is swimmer's ear? How do you get it? How do you get rid of it?
Right. Swimmer's ear is an infection in the outer ear, and it's just when, you know, some of that germy water gets in there and kind of settles in. It's very painful. I've had it before. It's not very fun. If you're concerned about that, or if you tend to get that a lot, we do have custom earplugs for swimmers and for the little ones who are having the tubes placed in their ears. We make those in the office. We make an impression of the ear, and that allows, you know, the kiddos and anyone who tends to get swimmer's ear to still enjoy the water without having to worry about, you know, hoping that they don't get the swimmer's ear. So.
How expensive is it to get a custom earplug?
Typically they're about $100 for the pair. And that's about, you know, if you were looking at a custom like musician's plug or something like that, it's going to be a little bit more, closer to 200. But yeah, for the swim plugs, yeah, about $100.
Is it a wise investment if you have a kid like on swim team who is constantly in the water?
Sure, especially if they, you know, tend to get swimmer's ear. You know, you can also use those drops that help dry up, you know, the water once they get out, and that tends to help also.
All right, you showed us a few hearing aids. Let's look at a little more. You brought a few other props with you. What do you have?
Yeah, we have some different styles and options. That was the smallest, or the smaller of the in-the-ear version. We also have, this is called a microphone in helix. This microphone actually tucks up into the top part of the ear. That's really good for golfers because it eliminates a lot of wind noise.
Oh.
We have a larger version of this, which just has a larger battery. So your battery is going to last on this larger one closer to 10 days, whereas this one it's more like 5 to 7 days with the smaller battery.
Now, are those ones you can recharge, or are you buying new batteries all the time?
We do have rechargeable battery options manufacturers that we work with, but with all of our hearing instruments in the top 3 tiers, we provide the batteries for 5 years.
Oh, that's nice.
So we're more about service in our office than just selling you a pair of instruments and saying see you later.
Yeah.
We provide quarterly office visits. Everyone comes in every 3 to 6 months, picks up their batteries. We do any adjustments, clean and check the hearing instruments, and that's all included in the price of the hearing instrument.
That's wonderful.
Yeah, so you're not having to run to the store and buy batteries all the time. We even mail batteries if people have, you know, if someone happens to move away or it's inconvenient for them to come to the office, we'll ship your batteries to you.
All right, so this was the little bit bigger one, the one you talked about earlier that connects to your iPhone or iPad and all that jazz.
Yes, we even have instruments this size that can connect with your iPhone, also an iPad or iPod Touch, and that's the generation 5 of the iPhone or later. Anything with that smaller lightning port can sync with something this size or larger. So this is the larger one. A lot of people would say, why would I want that larger one when I could have maybe the smaller one? People with manual dexterity problems who might not be able to handle this, and this is also going to require a smaller battery, which typically has to be changed every 4 days or so in the smaller model. These typically have a larger battery. Also, we can get more power in the larger instruments because with the smaller devices, we're not always able to get a speaker in there that's big enough to get enough power in there.
And you look at every individual and fit them for different things. You keep different things in mind.
Right. We have a very individualized approach. It's definitely not one size fits all. We fit hearing instruments based on each person's hearing loss, on their lifestyle, and on their budget. I'm not, you know, going to recommend the top of the line hearing instruments for someone who's in a nursing home, you know. So it's a very individualized approach for each patient.
Good enough. Let's talk to Betty. She's on the line calling in with a question. Betty, thank you for being with us.
Yes. I wanted to ask her about, I had an ear that got stopped up. When I shampooed my hair, it felt like the water was still in there, and I couldn't get it out. That went on for a couple of days, and then I started having a roaring in there. When I did go to the doctor, she said I needed to have my ears cleaned out. And when they started that process, I started getting real dizzy. I told them, they said, well, you know, that happens sometimes. And then I got awfully nauseated, and then started throwing up.
Well, this sounds terrible.
Yeah.
Yes, that was a bad experience, but it did take care of my ear, but I wouldn't want to go through that again. So,
Is that typical, what Betty was experiencing?
It is. If the water is a certain temperature and if your head is at a certain angle, it can kind of incite that vestibular response that does cause dizziness and nausea. And we actually, in a lot of the vestibular testing that I used to do at the ear, nose, and throat office, that was a very typical reaction, and we were looking for that dizziness to try to figure out what was causing each person's dizziness. But it's also very common to, when your ear is stopped up with wax, for it to get worse before it gets better. So if you get some water in there with the wax, and it gets kind of maybe behind the wax and kind of gets trapped in that ear canal, it can get worse before it gets better, and you might have to get the wax taken out in order to let all the water back out.
So what can she do differently so she doesn't have to go through this again?
I would recommend just maintenance on the ear cleaning. If you don't normally get your ears wet in the shower, then I would probably do the hydrogen peroxide. You could maybe mix it with a warm water, 50% solution of warm water and hydrogen peroxide, and pour it in your ear, once a month or so to kind of keep the wax from building up. That's good for anyone who doesn't typically or doesn't like to get their ears wet in the shower. But normally just pulling back on that ear, letting the warm, clean water go down in the ear canal is a good way to help keep the wax from building up.
All right, Betty, I hope that helps. I don't want you to have to go through that again.
oh, thank you.
You have a good night. All right, we also have Alan on the line. Alan, good evening to you. What's your question?
Yeah, I think the doctor mentioned something about for kids that there's some drops that you can put in there to keep the water out. What was that?
I can't think of the brand name at the moment, but I think there are some drops that are like ear drying drops.
I think it's over the counter, isn't it?
Yeah,
It's like
over the
swimmer's
counter.
ear. I think it may be that.
Right,
Swimmer's
yeah,
ear.
it's just an over the counter. They also make, if you don't want the custom plugs, the little wax plugs that you can put in your kids' ears to kind of help keep the wax from getting in there. Ask the pharmacist, because I can't remember the name of the drops for
But it would just be
drying.
a drying drop for your ear. Okay.
Another question.
Go ahead.
If someone comes in your office and they need their ears cleaned out, how do you do this?
It depends on the type of wax. So I'll look in the person's ear, and if it depends on if the wax if it looks soft or if it looks more hard and impacted. There's lots of different tools I can use. I'm very gentle. I don't like for people, and I have time. That's part of the reason I went into private practices, so I wouldn't have to be rushed when I was working with people. So I have lots of different tools I can use to try to, coax it on out gently. I also have irrigation and suction, which I don't lean people back when I do the irrigation so that we're not, starting that vestibular response to make people dizzy. But it, puts water in the ear and then suctions it back out, and we just try to loosen it up, and I'll switch back and forth between the, the tools and the water and irrigation and suction till we get everything out.
It makes sense.
Very much.
Yeah, you're
All
welcome.
right. Thank you for calling in. All right, let's talk to Lucy real quick. Lucy, what's your question tonight?
Yeah, I just tuned in late. If you've already answered this is okay, but you don't have to go over it again. But have you covered strep bacteria and ear infections in the young and old related to your teeth?
No, we have not, Lucy. You always call in with deep questions. We have not gotten there yet, Lucy. Thank you.
All right, thank you. Bye-bye.
All right, have a good one.
You too.
Any thoughts on that?
That would probably be a question for your ear, nose, and throat specialist or your primary care doctor.
Okay.
I'm not a medical doctor. I'm just a doctor of audiology.
Don't say just. You are a
I
doctor
still
of
had,
audiology.
yeah.
Yes.
But strep is kind of out of my realm of expertise. So,
Okay.
yeah.
Good enough. Good enough. And we should say you're a homegrown gal.
You're right. Yes, I'm from right here in Nashville, born and raised. I just went away 8 years for school, and then I came back.
And we got to talk about some of your training, because I read this and it just stuck out to me. You were on a pre-cochlear implant team, and I think
Yes.
that we've all seen those videos when someone's getting fit for those cochlear implants and they hear for the first time, and it always makes me cry, especially when it's a child hearing their mom's voice.
Yes.
It wrecks me.
Yes, me too. I cry every time. But yes, when I was at Children's Hospital in Birmingham, Alabama, I was on the pre-cochlear implant team, and so we did a lot of the pre-surgery assessment to determine if someone is a good candidate for a cochlear implant, and it was a very rewarding part of my training.
Oh, I would say that had to be, and those implants have come so far. I mean, it's just amazing what we can do now.
It is, and I always check people's hearing test results to see, and I've referred a few of my patients for cochlear implants, and they've had successful surgeries and they're doing great. And those videos make me cry every time too. I don't usually get that response with hearing aids, but I did one time with a high school student who had been kind of diagnosed with a learning disability, and then come to find out it was really just a hearing loss the whole time. So.
And they were already in high school by the time they found out.
Yes.
Think how much time and how much had been missed.
I know.
Just from not being able to hear.
Yeah.
If you have a child and you think something's going on, what should a parent do?
Definitely if they seem to be having trouble in school, or not understanding their teachers, or not understanding you, turning up their TV and radio too loud, those are all good signs and signals that, might just get the hearing checked and make sure that that's not the problem.
Okay. Okay. And then, of course, let's touch on those real quickly, the signs for maybe an older adult that they're starting to really have significant hearing loss.
Right. Asking people for repetition, especially, female voices are typically the first that are more difficult to hear. Turning up the TV too loud, not being able to understand in a restaurant or background noise situation is a very common complaint, because a lot of times, like I said, when you have that good low frequency hearing, that's where the background noise sounds are, in those low pitches. But if you're still missing those consonant sounds of speech in the high frequency range, a lot of times that's where people are starting to have more trouble. And then also without the visual cues. So a good communication tip for a loved one would be, if you're talking to someone, try to place your face where there's light shining on it. Don't talk with your hands over your mouth. Get someone's attention before you start talking. Right, and go into the same room as them so that they can see you while you're trying to have a conversation with them.
Okay, with that, we're going to take a quick break. We'll be right back.